what we don't want to have owners do is like, oh, my cat is in pain. I shouldn't make him do anything. He shouldn't move, because that's like the worst thing to do for osteoarthritis. You have to keep them moving. So it's just, how do we get them moving at home? And this is where the owners come in. You're like, what does the cat do at home? How does it react? Does it have other cats at home? Trying to figure out what the cat does at home, because obviously the owner knows it best, and kind of incorporating those things into a rehab plan.
Welcome back to VetFolio Voice. We've got a great episode for you. For this episode, I was joined by Wendy Davies, and we got to talk in person in the studio. It was very exciting. And we covered a topic that can really fly under the radar sometimes, and that's chronic pain in cats. Cats, they're masters at hiding pain, especially when they're in the veterinary clinic. And unlike dogs, who also do a pretty good job of hiding their pain, cats will rarely show any obvious signs during exams, especially when it comes to chronic pain, and that can make it tricky to identify when they're having issues, when they may be suffering chronic pain. So as veterinary professionals, we need to collaborate with cat owners to understand what they might be noticing or not noticing at home, since that's where we'll really start to see these chronic pain behaviors to indicate that they're hurting. Wendy was fantastic to talk to, and together we dove into all the ways that pain presents differently in cats, how to communicate effectively with clients about what to look for, because as we all know, that can be a challenge in and of itself because cats can be so subtle about their pain symptoms. And of course, we got into the range of treatment options beyond gabapentin and NSAIDs. There are so many options out there. This was a great talk, lots of practical tips on how to improve pain recognition and approach multimodal management for our more subtle presentations in our feline patients. Like I said, my guest was Wendy Davies. She's a certified veterinary technician and veterinary technician specialist in physical rehabilitation with over 30 years of experience in the field. She spent the last 25 years at the University of Florida Small Animal Hospital, where she's been instrumental in developing their physical rehabilitation program, which is now staffed by a full team of boarded faculty, residents, specialty interns, and dedicated rehab nurses. Wendy is a charter member and past president of the Academy of Physical Rehabilitation Veterinary Technicians, and she's passionate about advancing the knowledge of physical rehabilitation in veterinary medicine to help pets live longer, pain-free lives. With experience in the field ranging from anesthesia to orthopedic surgery to her true calling in rehabilitation, she brings heart and expertise to everything she does. Let's go ahead and get into it.
Things can get a bit chaotic in the waiting room, can't they? Don't waste time with clunky practice management software. There's a solution that just works. Say hello to ProVet, an intuitive modern system designed for the very best in animal patient care, empowered by the latest AI productivity tools. Your dedicated veterinary software since 2001. Find out more by searching Get Set for ProVet.
Wendy, thank you so much for joining me. I'm so excited we could do this in person. I always like recording these face-to-face compared to over Zoom is great, but there's just that personal interaction when we're face-to-face.
And there's like a delay on Zoom sometimes, and it kind of throws off the flow. So it
can, and you don't get quite as much nonverbal communication, which I always feel like as veterinarians, like we need the nonverbal communication.
Exactly, because that's how we work. Yeah.
Yes, absolutely. And we're going to talk about something that's super important, but maybe doesn't get enough play because it can be really difficult to assess and even harder to come up with therapy in these cases. Is chronic pain in cats. So thinking about that, this sounds like a silly question. Like, why is it important that we're on the lookout for pain in cats? If we have owners that are coming and saying like, these cats are fine, what are we kind of trying to be aware of?
Well, it's kind of very common for them to get osteoarthritis. It's like 80% of cats over 12 years old or something have osteoarthritis. And I was just kind of thinking about dogs as well, because I just saw a seminar about dog osteoarthritis, and dogs with hip dysplasia that are puppies, they're born wrong. They're kind of born with arthritis, and we don't treat them early because they don't really have a lot of pain at that time. It's not really crunchy and stuff. But with cats, they hide pain so well that, sometimes you don't realize until they get older and they don't want to get up anymore. They don't want to, pooping outside their litter box or something like that, when the owners are like, something's wrong, I should bring them in, and if we can catch it a little bit earlier, then we can make them a little bit more comfortable as they age, instead of like trying to catch up after it's already happened.
Yeah, and they're already in pain and experiencing that wind up and everything like that. So along those lines, I'm 100% with you. Like, let's catch it as early as possible. But how do you do that? They're so good at hiding their pain.
Yes.
So can we bump up our physical exam? Are there different things we should maybe be adding to our physical in order to pick this up?
Yeah, I think that, obviously it's really hard to do a orthopedic exam on a cat in a hospital, in your vet hospital, because they don't want to walk when they're in there. They like slouch around or they don't move or hide in the corner or something. And so you can kind of like on your annual exams kind of add something to, now that everything's like via email and all these little apps and stuff, see if you can send like some sort of survey to the cat person before they come in, just asking them questions about what the cat does at home, even if they're not complaining but the cat's doing something weird. If they're just coming in for annuals or whatever, that's kind of the perfect time to catch things, and because people know that they don't bring cats to the vets very often, so if they can bring them in and just end up doing like a little bit more of a thorough exam as far as, range of motion and feeling the stifles and elbows and hips and all that maybe we can catch some of these things a little bit earlier before they become a problem, and, kind of save the owner a little bit of headache, later on when their cat's like, it's not moving, I don't know what to do,
It's pooping outside the litter box.
Exactly. When they come and see you, they're like, this is wrong, something's wrong. And, instead of, it's obviously I'm in a specialty practice, so my brain goes to different things than in general practice. But, as far as just thinking outside the box, I'm like, yes, you feel the abdomen and all that, but, maybe try to add like a little baby ortho exam just to kind of see, because we see a lot of cats with patella luxations and cruciates and, and just, you wouldn't think about a cat having those, right? And so if we can kind of prevent those from getting worse, then, I'm all for it, like either with exercise or diet and weight loss, supplements, pain management, any of that kind of stuff. So it's kind of, important for you to catch those cats early, and then possibly you can kind of get them in a little bit more often. You put them on meds and like, okay, come back in a month, we're going to see how things are going. If we want to continue the medications, we want to change the medications, the cat's not responding, those kind of things you can kind of catch up with.
I kind of love how we're coming up with these checklists where owners can do some evaluations at home, because there's only so much that we can pick up on an exam room. And, cats, I feel like sometimes even when they're in pain, they'll still stretch out
they'll
super
stretch
long
out and they'll be like, I'm fine. And we always joke that cats don't need vets, And
Right.
like, I'm treating a cat that has 2 legs and it runs around just fine.
No
I'm
kidding.
like, it's amazing. I'm like,
gosh.
These cats are amazing. I'm like, I'm telling you, they don't need vets.
No, they will tell us like when they need us to intervene, and
right.
Usually like they've got it.
Yeah. And just like picking up subtle signs at home, because I'm guilty of it as well. I had a cat and he was standing on top of one of my dressers or whatever, and he was kind of holding his paw up, and I'm like, that's weird, and you don't really pay attention. And I was like, I'll just bring him in and see what it is. He broke his toe, but he'd been like kind of sort of lame, and I didn't really pay attention, and he was like, whatever, he's just walking around. I'm like, he has a broken toe.
Broken.
Exactly. So just knowing what to look for. Like once I figured out, I'm like, okay, watch your cat jump. Can it jump up on high things? Can it not jump on high things? Does it kind of stutter jump, and then if it does jump, does it clear the top of the dresser, or do they have to use their back legs to climb back up on the dresser? That's a sign that there's some sort of pain going on,
right.
And like, because they can't clear anything. And, if they're just not moving at all, or if they're like hiding somewhere, but then some cats are like, whatever, and they just lay in the middle of the floor. But there's very subtle signs that if we can, send just information out to owners just for what to look for and stuff, because I think that obviously dog osteoarthritis is like beat to death as far as advertising and stuff, but there's really nothing about cats, and cats experience the same thing as dogs do. And I just think that it's just harder to catch because they don't come into the vet as often.
That, and I think that there's that owner perception that slowing down is normal. You know, oh, he's just getting older, and that makes my eye twitch so much. Where I'm like, no, that's not really a thing in a lot of these cases. At least not, you know, at 10 years old or whatever it is.
Absolutely, yeah.
So there's more we can do, but you're right. The signs are subtle, and I think it can get easy to kind of get into the mindset of, oh, it's second nature to us, so the owners will for sure pick it up and bring it up at home.
No.
But I've even heard subtle signs like the way cats walk up the stairs, like they should go one, you know, just steadily up the stairs, not onto the stair,
like
onto
stutter
the next
steps,
stair.
yeah, exactly, yeah. You know, it's kind of like cat bunny hopping when you think about with dogs,
Sure.
you know, and with hip dysplasia, but, you know, they're very subtle signs, you know, they're not as overt as dogs are, but, you know, the more we can educate them, even if they're in, you know, obviously they're in for their annuals and stuff, and just kind of have your tech or something talk to them about cats and osteoarthritis, because invariably they're probably going to have it at some point, you know, and just like, yeah, you can watch for these kind of signs and things, you know. Obviously that's what your tech is there to help with as well, you know. I was talking to the owners, and sometimes you get a little bit more info out of them with the tech talking to him than the doctor. You're like, everything's fine, you know. But
Yep. I know. Whenever I have a technician who's upset because they're like, you know, I ask him that same question and then you ask and they gave the different answer, and I'm like, it happens to me too. Like sometimes some things
vice versa.
People won't tell me.
Yep.
It might seem kind of insignificant if an owner hears it one time, but hearing it from multiple people and hearing it reiterated can really paint a different picture of how significant this is and how seriously they need to take it.
And there's like, you know, it can put things in your exam rooms or something, you know, just make your sign, you know, just, hey, you know, does your cat have osteoarthritis? And, or leave like the little metrology things that you can get online as far as, you know, does your cat do this? Does your cat do this? You know, and just to kind of make them realize, oh, my cat does do that, you know, and that'll give you as a vet more information of like what to look for kind of thing. Like, oh, well, maybe something is going on osteoarthritic wise. So.
And I love that you bring up the metrology instruments. Can you elaborate on those a little bit? I'm actually like, I think I knew of these before, but I didn't put it together to call them clinical metrology instruments. So tell us a little bit more about those. Enlighten us.
I know, enlighten you. So NC State, their veterinary school has amazing pain researchers there, Duncan LaSalle's being one of them. And he has done a lot of work on cats. I did some work with him when I was doing research. You know, we did the buprenorphine study that works in cats orally, so that was kind of cool. But he has done a lot of work in cats as far as pain management. He's developed these, he and obviously all of his colleagues and stuff have developed these clinical metrology instruments where you can give one to the owner and ask questions about what, you know, different questions about what the cat does. There's one for veterinarians, what to look for when you're doing your exam, just to kind of guide you as far as what needs to happen. And you can kind of have the owner take these and then you can track them out, you know, if they come multiple times and stuff. But it helps just kind of narrow down the questions that you would like to ask and see in the cat before you even see it, you know, because they obviously, when they have the time to do it at home, it's a little bit less rushed than opposed to like, you know, they're in the waiting room, like, here, fill this out, you know, like they do in doctors' offices, you know, like, oh, I'm trying to fill, okay, go in the room. I'm like, I'm not done.
Right, exactly. Yeah. Am I in pain? I don't know.
I know, exactly. So at least it gives them a little bit more time to think about what, oh, well, my cat is doing this, or like, oh, I didn't realize that was a thing, you know. So, and the same thing, you know, having doctors, you know, fill out the form and everything when they examine the cat. It gives them a guide as far as what to look for and stuff. And, you know, I think it's super helpful just to have something, because it's not something that you guys do a lot as far as, you know, orthopedic exams on a cat unless there's something broken or whatever, you know. But just doing range of motion, you can get a lot of information, you know, as far as that goes. And if they videotape the cat at home in addition to the clinical metrology thing, then you have a lot of information before you even touch the cat.
And I feel like I've been talking about this a lot lately. It's like planting the seed with the owner, because in those exam rooms, time is precious. We have a lot to talk about. So if an owner doesn't have osteoarthritis and chronic pain on their radar, it can be very easy. You know, any concerns at home?
Absolutely.
No, I have no concerns at home.
Exactly.
But you kind of, like you said, you put the sign up, you put the metrology instruments out, you know, you follow the exam guidelines and make sure you're checking these things as much as cats will let you. I'm like,
they're
just
cats.
I'm like, there's one, I swear, like had a broken femur and was like stretched out. I'm like, do you feel pain? I know you do, but they hide it so well.
Yeah, they do.
And yes, and I have seen ACLs and MPLs in cats, and I'll never forget the first like slam dunk cruciate ligament I saw in a cat, and I was like, do cats get this? And they do.
Yeah.
So yeah, paying attention and finding it, because you know cats may not go three-legged in the same way that dogs do.
No, not at all. They like show it completely differently than dogs do, and it's hard, you know, in general practice when these cats come in, they just come in and they're like, I'm fine, you know. I'm like, but they don't show that there's usually any pain unless there's something really wrong, you know. But
then if the owner kind of sees these signs and goes, oh, maybe my cat does do that, and maybe we get another visit in and we're having that conversation more, and that can develop, you know,
things to do, and you know, we can, you know, home exercises, you know, just having them do things at home as far as strengthening or getting the cat to move. I know that's the hardest part, is getting the cat to move when it doesn't want to. But, you know, and obesity in cats obviously is a big deal, and it's a big deal for cats with osteoarthritis. And so, you know, having that conversation with owners, I know it's super hard to have that conversation with owners with obesity with dogs or cats, but just kind of letting them realize there's so much more weight on those joints, and, you know, you can put it to people, you know, it's the same with people, obviously. And so if you can kind of get cats into a normal weight, you know, then it'll take a lot of that stress off those joints, and you might not need as much pain medication and all that, you know, because they're thin now, you know.
Yes, and there's not a lot of options we have for medication.
Exactly.
So please get the weight off the joints so we don't have to go the medication route, because then we run into a whole nother set of challenges.
You know, because like, oh, we have these meds, but the cat won't take it. You know, I can't give the cat a pill. You know, I'm like, can you do something oral? And then you have to go to compounding and all that. And sometimes there's some topical stuff that may or may not work. And, you know, like some of the drugs that we use are like gabapentin, ketamine, Silencia, you know, those kind of things that, you know, we can kind of get a hold of. But and then sometimes there's cats that have this hyperesthesia syndrome where you touch them everywhere and they freak out, you know. So we're not
just like chronic
wind
pain.
up pain. Okay. So I think they've been painful for a really long time, and it's hard to localize because everything you touch is painful, you know. So if you can calm that down, and so sometimes we use amitriptyline for that, and then go home on amitriptyline, and then come back, and then we'll try to figure out, because
is that a ketamine application too?
Sometimes we give ketamine, you know, sub-Q, and then put them on amantadine after that, you know, just as a kickstart for the ketamine, like a loading dose instead of that, because amantadine takes a while to work, 30 days or something before it kind of gets to full, you know, peak efficacy. You know, just it's very limited. Onsior, you know, that's one of the other ones that, you know, because even now, like, I can't think, you know, thinking of cat drugs, because I know dogs like down pat, you know, but then you're like thinking about cat drugs. I'm like, oh yeah, cat drugs. And I'm like, yeah, that's a tough thing, you know, because they don't take it, or, you know, we
have meloxicam and it has a box warning, and
exactly.
you know, you have to watch out for things there. You know, and so much of it is off label that
absolutely,
you know, it's those conversations with the owners. Versus we have so many more options for dogs, and dogs also, they tend to maybe be a little more amenable to coming into the clinic compared to cats, as we've seen from the evidence.
Oh, attention, you know,
yeah. So doing, you know, when we say, oh, well, we need you to, you know, come in and do cold laser or acupuncture or something like that, dogs are like, yeah, no problem.
Yeah, cats is the problem.
Yeah, cats may feel a little differently about that.
So that's why we try to get where we can have the owners, if they feel comfortable, do things at home, you know, like, you know, you don't think about like massage is, you know, doing that to your dogs or cats, you know, and it's a thing, you know, you can do that, you know, if you just petting them, even, you know, just petting, you can get some things. Like initially when you start at the head and go to the tail, sometimes you can feel hot spots, sometimes you feel cool spots, you know, that might cue you in, like the first couple of times that you pet the cat, that there might be an issue here or whatever, and just kind of trying to get them used to getting handled as far as massaging and things. And you can help them a lot doing that. Just loosen up muscles and bring heat to the surface, so if they're stiff or whatever, instead of putting a heat pad on them or something, you can heat them up yourself with just petting them, And there's other things. There's like a CC loops, which is pulsed electromagnetic field therapy that owners can buy and put over the cat, which, work fairly well with pain, and it's not something they have to give orally.
How do those work? Because I'm fascinated by the idea, but I haven't gone far enough down the science road to understand actually what's going on.
Yeah, it's kind of one of those weird things that's difficult to explain, So
Makes
we all
me feel better.
Yeah, no, it's very difficult when I try to explain to students. So your body is positively and negatively charged, right? And sometimes when there's like issues with disease or pain or whatever, those cell membrane potentials change. And so what you're trying to do with the CC is like realign those positive ions and negative ions on whatever side of the cell membrane they're supposed to be on, and kind of help at the cellular level as far as trying to help with pain management, because so many of the things that we use in rehab are cellular level. So your laser is at the cellular level, therapeutic ultrasound is at the cellular level. So it's not something that you can like, I'm shining a light at this and I can see it happen, but it's a very subtle thing. You're shining a light at this and something is happening within the cells, and it's increasing ATP production and changing over cells faster, blocking substance P, so all these things that are working at the cellular level, they can't really like see them happening, but something is happening inside the dog, or the cat.
So would it be kind of correct logic to say, with the CC loop in particular, if we have this maladaptive pain, we have synapses firing that shouldn't be firing?
Yep.
And so we're adjusting, we're influencing cell membrane potential to help those synapses fire appropriately.
Appropriately, yeah.
Yay! I got. So, yeah. You were explaining. I was like, oh man, I think I'm wrapping my head around this, but I'm not.
It's like
sure.
so hard to explain. It's like it just works, okay?
It just works. Just do it. But along those lines, we talked a little bit about medication in cats and the limitations that we have there.
Sure.
What are some of the other modalities, kind of like what we were talking about here with acupuncture and a CC and things like that you've seen be really effective in cats?
Yeah, cats are very responsive to acupuncture usually, which is kind of a weird thing to think, like, oh, the cat's going to sit there with needles in it. But they actually respond quite well to acupuncture. And so we have cats come in for acupuncture. I have cats coming in for underwater treadmill, just for strengthening and stuff.
I just want to go watch that.
Yeah, they walk in the underwater treadmill. It's fantastic, and like, you can't put a cat in the water. I'm like, watch this, and they like it, like begrudgingly, obviously. And like, there's some that are walking like, wow, like the whole time they're doing it. But it's actually, a great modality to get them to do to kind of help with resistance and strengthening, as far as those muscles around hips and stifles and things. And, just getting cats to do things at home as well. Exercising at home. We have, walk over little obstacle courses, which is what we have cats do sometimes when they're in hospital, and then owners can do that at home as well. So you can take like, I don't know, broom handles or whatever, and just make like some sort of obstacle course that the cat has to go over. I have one owner that's like amazing, and she's trained her cat to use those buttons that talk, and so
her cat does it.
It's pretty awesome.
She could also sell tickets.
I know, she could.
I love that.
Yeah, and she does so much work with that cat at home as far as exercises and things. Comes to see us, and I was like, I can do acupuncture, and laser, because she's doing all the stuff at home already. It just depends on how invested they are and to help their cat and everything. But there's a lot of things that we can do with cats as modalities instead of drugs, laser and therapeutic ultrasound, massage, stretching, any of that kind of stuff, or laying on a magnet bed, because there's magnet beds as well, or heating pads. They like those. They do. And so, just put that on the chair and just have them sit in there,
Yeah. Well, and I'll say it with the acupuncture. I just recently had my first kind of like personal experience with acupuncture, which, I certainly have believed in the modality from the results I've seen in patients of other doctors, because I'm not a CVA,
right,
for a long time. But then my dog recently had acupuncture for a neck injury, and oh my gosh, it was such a huge difference.
It's kind of crazy, isn't it? Yeah.
The sensitivity of being able to find where the pain was based on placing the needles and things, I can 100% buy into cats enjoying, laying there and getting stuck and keeping the needles in. And then also because they are such masters of disguise when it comes to pain, that may be serving a dual purpose of helping localize some of that sensitivity as well. And I'm speaking out of turn because, like I said, I don't do acupuncture.
That's totally true. Yeah, because you can, usually when we're doing our exams and we're just feeling the cat initially, like you go down their spine and you get twitching and everything, and people think, oh, that's just cutaneous trunci reflex. And I was like, no, the cat's responding to that when you're doing it. It's not a reflex, it's kind of like, they're like, oh, that kind of hurts, Okay. And so you can get that kind of pain as well along the spinal paxillus because they're compensating a lot. Any of those hip flexor muscles as well, if they have hip issues or stifle issues, those are going to be a little bit sore. And so sometimes you can just like pet the cat and like have it stretch out its back leg as you're stretching, so you're doing massaging and stretching those back muscles, those hip flexor muscles out and stuff. And they tend to like that. Like, I kind of liken it to, you get up in the morning and you stretch and how great that feels, and kind of the same thing. Like they're not doing it on their own for the most part because they think it's going to hurt. But if we're doing like a massage, they'll relax and everything. And then you can kind of push that leg back out. And sometimes they move into it and they just stretch the legs on their own afterwards. You just have to start it, So just stretching is a huge thing too. It's just like, same thing with people. You don't go running a marathon without stretching. But, just the benefit of that, alone is good for osteoarthritis as well. Because, what we don't want to have owners do is like, oh, my cat is in pain. I shouldn't make him do anything. He shouldn't move, because that's like the worst thing to do for osteoarthritis. You have to keep them moving, and so it's just how do we get them moving at home, and this is where the owners come in. You're like, what does the cat do at home? How does it react? Does it have other cats at home? Does it like playing with this? Does it like catnip? Trying to figure out what the cat does at home, because obviously the owner knows it best, and kind of incorporating those things into a rehab plan. So things the cats are already doing, we're going to put that into your rehab plan. Okay, the cat should do this X amount of times, every other day or something, just to kind of, they're already doing it, so we might as well use it for our benefit.
Absolutely. Absolutely. And especially, I'm glad you explained the stretching because you had mentioned stretching before. Yeah. And I was like, how do you stretch the cat? I'm picturing like we're holding the cat up or something. Like, I don't understand the stretching. But what it's like just hang them by their front legs for a while. They'll stretch out. Spinal traction.
That's funny. Like, I feel great. Yeah.
Yes, but no, that makes sense. And yeah, especially if you have one of these cats that's really amenable to that kind of petting and massage and stuff, that just using it for the cat's benefit and getting that feedback and that information. Certainly in our conversation, we focused a lot on osteoarthritis and orthopedic issues because that's a major source of chronic pain in cats. What are some other sources we maybe wouldn't think about as sources of chronic pain?
Yeah, visceral pain. So that's a good one. And sometimes there's behavioral changes with that. So as far as, excessive licking, on their belly or whatever, some cats do that. Like, do they have GI issues? Do they have urinary issues? Some cats, going back to osteoarthritis for a sec, will lick the appendage that hurts them, and then just, visceral pain. They have teeth pain, mouth pain if they have bad teeth. Eye issues are painful. You kind of think, if you've ever had something wrong with your eye, it's really annoying. You probably have a headache, and it's just cancer in places that, it's kind of sucky, but lymphoma, your cat's just kind of chilling now and not doing anything. And the cat that I was talking about with 2 legs, it has FIP, and so it's like, now we can treat it. And so we're treating it, and the cat's fantastic. This cat is indestructible. It's literally indestructible. Wow. It's amazing.
I need to meet this cat. I'm like,
he has an Instagram page. I'll tell you later.
Okay, good. Yes. Can you tell us now? Like, can everybody follow it?
Shay the Warrior Cat.
Shay?
Shay. I think there's like an underline and then Warrior Cat.
Shay the Warrior Cat. Yeah. I need to go see the 2-legged
It's pretty
cat
amazing.
With FIP. That is amazing.
It like runs along. We're dealing with, we had a endoprosthetic in it, and we removed it because of some infection. And so now it's running around in 2.5 legs, and we're going to hopefully put a prosthetic on that other leg. So
which legs is it running around on?
The front right is the one that's had the endoprosthetic in it. Okay. And then the left front and left rear are there.
Okay.
So front is a half a leg.
Was he born that way, or
he was actually found in Dubai.
Okay.
When she was over there, and then we assumed he was hit by a car. So,
No
and
kidding.
like you can follow like the whole thing on that
Wow.
Instagram page is pretty amazing. This cat.
I mean, I always say that cats are indestructible, and and when they're like, "Is it gonna heal?" I'm like, "It's a cat, probably."
Yeah.
But that takes it to a
This
whole new
cat
level.
is like indestructible, and he's super nice. He's super sweet cat, you know,
Aw.
and just loves to be petted and kissed, and he'll kiss you back, and he's great. Like mom's done an amazing job with him.
Wow.
Yeah.
Oh my gosh. That's wild. I'm so glad we talked about that. So we talked about some of the different modalities in terms of medications, and I don't know what we would classify external modalities, acupuncture and such. What about thinking of things that owners can do at home? What about supplements?
So definitely the number one thing that's been proven to help in osteoarthritis is fish oil. So the deal with fish oil, like you find a lot all over the place, as far as what the quality of it is, but it's the amount of DHA and EPA that should be in the fish oil to actually make a difference. And so cats obviously generally love fish oil. So that's an easy thing that you can give them that they'll eat, because you can put it on their feet, on their food, or you can add a sardine, like anything like that that's a little fishy and a good product. We do often use Nordic Naturals because we know that's a great company to kind of get things from. That's kind of the number one thing. And, as far as more supplements, CBD. So the only problem with cats and CBD is sometimes it doesn't taste good for the cat, so they won't eat it, So sometimes the dogs are like, it's fine, I'll eat it, and so, but it's a possibility. There's liquid, there's little chewies and things that the cats can use. And then Adequan, which technically is not really a supplement, but it's like more of a treatment that basically helps with protecting cartilage. It prevents cartilage degradation. So it's a polyglycosidated glycan, PS gag, that you can give sub-Q, actually. There's a loading dose, and then they give it monthly after that, and it can kind of help with preventing that cartilage degradation that might happen with osteoarthritis. And it can make them feel better as well, just because it's kind of preventing that.
So do you approach Adequan differently in dogs versus cats? And what I mean by that is, I love that you mentioned sub-Q, because I also give it sub-Q.
Sure.
And from what I understand, like pretty good evidence that we're doing just fine.
Yeah.
So in dogs, I've heard mixed recommendations as far as should we continue it monthly or should we use it when they're having flare-ups? What's your thought?
Yeah,
is that different in cats?
It's different now. So when Adequan first came out, it was like this loading dose, and then you give it monthly for however long till it needs it, And then now they've changed the way you give it now. I think it was the loading dose and then like one, and then you don't give it anymore or something,
That's
So
what I've heard, yeah.
Yeah, so, since it's kind of technically, not really talked about in cats, I assume that it'd probably be the same as far as dosing goes, but it's good. You can give it sub-Q, it's not like it's, against the law kind of thing, and it still has efficacy. But my thought process was like, if you give IM injections for a loading dose, you're injecting it into a muscle every week. Yeah. And so that's painful. If all of, our COVID shots, I'm like, your arm is really painful after it. So it's the same thing with the cats, I'm like, you're kind of creating more pain and giving it IM. And so giving it sub-Q is kind of a lot easier to do it. Owners can do it at home. We can teach them how to do it at home, buy their bottles and,
just like
syringes,
we do in dogs.
needles, just like you do in dogs, and they can give it that way. And obviously you get better client compliance with that, so they don't have to bring the cat in for an injection all the time, weekly for the loading dose or whatever, which, cats love coming into the vet all the time.
Especially when every time they come in, they
shot.
get poked.
Yeah, exactly.
Yeah, absolutely. And another, kind of safe option, I've recently in a dog had some GI side effects, but knock on wood, that I generally don't see a lot of issues with Adequan.
No.
Unlike every other pain medication in cats.
Exactly. I know. Yeah. The dog's vomiting. It's got diarrhea,
Yes.
And so it's hard. Like, this way I'm like, okay, this is like the most innocuous thing that you can probably do other than the CC loop, It's like just lay it over the cat, but just trying to think of things that you can do, because cats are hard as far as pain goes, as far as giving them drugs and things. But some of these compounding pharmacies are getting pretty good at compounding things that are palatable to the cat. So, that's another thought process, like, oh, I want to give this cat this at this dose. And then you call the compounding pharmacy and you say, hey, what can you do? as far as that goes, you know, so do you think it'll eat a treat? Do you think it'll eat some topical thing on its food? And then you can kind of go from there, and they'll help you as far as designing and what flavor they want and all that kind of stuff. And so sometimes that's super beneficial, you know, that you can kind of hopefully start out instead of just like, here, give this and pill your cat, because nobody really knows how to pill a cat, you know, unless they've had them for a long time and understand and have done it before, you know. But trying to explain to somebody how to pill a cat, especially as when it's painful and cranky,
right?
You don't want them to get bit, right?
Exactly.
You know?
That's what I'm always fearful. I'm like, I can teach you how to do this, but we might, like, I fear for your safety.
Exactly. Like, especially some people, I'm like, oh, that's not going to go over well.
No. Some cats too.
Exactly. Yeah.
He
The
will
cat's
chew
like,
your
you're
fingers
not.
off.
I mean, my cat was one of those. I'm like, I can't believe I can't pill my own cat. You know, I could not pill that cat. He was like, nope, you're not going to do it. I'm like, how is this even possible? This is what I do for a living.
There's no shame in that. There are some cats that are
crazy.
just, I mean, they're like, they're tiny panthers.
They are. I'm like, he went nuts. I mean, he's usually he was the calmest, chillest cat, but by God, you try to pill him and he turns into Satan. So
You will not shove that down
yeah,
my
exactly.
throat.
He's like, I'm not taking that, so you could go away.
Yes. No, but that's a good reminder about the compounding pharmacies. I think, I know I forget that sometimes to try to
absolutely.
just change the formulation and see if you can get it into them that way.
Definitely, you know, cats, little dogs, you know, if you want to do pre-gab or something like that, you can use that and they can compound things. And so I know pre-gab is a little tougher because of the DEA issue and stuff. But even gabapentin we've done, you know, as far as compounding into a liquid form that they can use. And it's been, you know, fairly successful because you can get them in the cat, you know.
Absolutely. In this conversation, I feel like I'm walking away with a lot of good reminders to make sure we're on the lookout for chronic pain in cats, and not just by doing it in the physical exam, but by incorporating owners and, you know, really getting specific and remembering that there's a lot of things that can cause chronic pain in cats. And that while the options require more creativity than they do in dogs, that they're out there. So thank you so much for joining
it's been great.
me. Any final thoughts you want to make sure the audience takes home if you remember nothing else?
Nothing else. Cats have pain.
That's a great. I love that. That's a perfect take home message.
Yes, just you just have to look at it a little bit differently than you do with dogs. But you know, the more we can do for cats, or you know, cats are great. You know, and to let them live a longer pain-free life, kind of thing, by catching things a little bit earlier than you normally would. I think that's kind of the take-home thing. Is just look for it. You know, when you're doing your exam, it, you know, adds like maybe 5 minutes to do your exam and just do range of motion and see how things are going. And then use those, you know, survey things that you can send to them before they even come in, or have them video their cat doing something, you know, just so you have more information. And it's better for you because you're treating this cat all the time, you know, you're a patient. And so you kind of want to know what it's doing at home versus obviously when it's at work for you, it's not going to be doing much for you. Absolutely.
Yeah, I feel like even when the owner takes out the video camera, the cat's gonna be like, nope, not
exactly.
doing it anymore. Something
they,
has
plop
changed.
Down. Exactly.
Yeah.
Like, I'm camera shy.
right. So they're gonna make it difficult enough. So
exactly.
coming at it as a team. I think that's such a good reminder. They're not small dogs, and they do present differently, but they do have pain.
And just to kind of, you know, involve the owner in the care with you. You guys are a team, you know, like veterinarians and the owners, we're teams, you know, and we're looking for the best for these animals, dog, cat, fish, whatever, you know, and if we can kind of help cats, which are kind of sometimes not thought about as having pain, I think that is all I care about, is just to consider that they have pain too.
I love it. And so, you know, keep talking about it, because I can hear, you know, your experience and your knowledge and your passion about it. And and then for reference, this talk was born out of an article that you wrote for TVN, Today's Veterinary Nurse, on Feline Chronic Pain Assessment. So if you want to hear more from Wendy, go find her article.
There's stuff in there. Those metrology things are in there. So, you know.
Perfect. Well, Wendy, thank you again for joining me. This has been a lot of fun.
Yeah, no, this has been great. It's cool. Yeah, thanks.
Wendy, it was so great to see you. Thank you so much for joining me in person. What a great time. What a great episode. Thank you to everyone for tuning in. I hope you enjoyed it. If you did, please consider leaving us a 5-star review wherever you get your podcast to help other veterinary professionals out there find this and other great content we try to put out there. If you enjoyed this episode and you'd like to hear more, you can click on the education tab on the VetFolio website, or you can find us wherever you get your podcasts. And as always, we would love to hear your input on this talk, as well as ideas for episodes you might like to hear in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also find me on Facebook at Dr. Cassie DVM, or we can connect on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.